it avoids flexion of the upper limb joints, and this is easier for this horse with hind limb lameness. This horse is looking out and also leaning in. This horse was less willing to move on the right rein compared with the left rein. And I think that this indicates that the horse was more uncomfortable on the right rein than the left rein. These assessments are more difficult to determine if you evaluate the horse trotting in hand in circles. I think, with respect particularly to hind limb lameness, I also want to evaluate the quality of the canter, because in some horses with hind limb discomfort, there may be no overt conventional lameness, but the quality of the canter may be compromised. I like to evaluate the horse moving both on a soft surface and on a firm surface on the lunge. I want to look at the horse's balance, step length, hear the rhythm, look at the range of motion of the thoracolumbar-sacral region. In general, most but not all foot-related hind limb lamenesses are worse in circles on a firm surface compared with straight lines. Is there any pattern of horses appearing lamer with the lame hind limb on the inside or the outside of a circle? In general, I would say the answer is no. It seems to be an individual choice. I want to reiterate that I prefer to see horses move on a gravel surface versus a tarmac surface, because gravel is less likely to be slippery and the horses will trot with more confidence. I always lunge horses on a soft surface first, so if they are overly exuberant, they let off steam on the soft surface rather than on the firm surface. The use of a slight gradient can also be useful. I think it is important to observe the horse performing transitions in hand, on the lunge and ridden, from walk to trot, trot to walk, trot to canter, and canter to trot. And this is particularly the case with hind limb lameness. If the horse jumps into trot rather than pushes off smoothly, this may reflect lack of hind limb push because of pain, or sometimes because of weakness, or a combination thereof. In downward transitions, a horse with hind limb lameness may be croup high because it is unwilling to engage the hind limbs, and this is particularly true during ridden exercise. We have to bear in mind that there may be the concurrent presence of both hind limb lameness and ataxia, both of which can contribute to abnormalities of hind limb gait. Irregular height of steps, an irregular rhythm of steps, and bounciness in a downward transition is usually a reflection of ataxia, which may mimic lameness or be present in conjunction with lameness. So let's look at this horse. We can see we've got more truncal sway to the left than we have to the right at the walk. The left metatarsal region is not loaded completely vertically.